Hello everyone, I'm Dr. Karan Shetty. I'm a board certified plastic surgeon from Bangalore, India. Today we're going to be talking about the web's most searched questions on gynecomastia or man boobs. So let's go. Our first question: what is gynecomastia? Gynecomastia, also commonly known as man boobs, is a growth of fat and breast tissue or glandular tissue in men. It affects approximately about 30 to 40% of men. It's not a disease. It is mainly a cosmetic problem which can cause huge social embarrassment to men. Like I said, it is a combination of fat and breast tissue. There are grades of gynecomastia that we know. There are grade 1 to grade 4 depending on the amount of tissue that is present along with the amount of skin laxity which is present. So the more amount and the more skin laxity, the grade becomes 4, and then subsequently it goes lower depending on the amount of skin laxity and amount of gland tissue. Our next question is, what causes gynecomastia? Gynecomastia is seen at pubertal age. One, because of hormonal imbalance, that is the amount of estrogen that is supposed to get at a particular age stimulates breast tissue in men, because of which they develop glandular tissue along with fat around their chest region. There are also other causes, like in bodybuilders where they take steroids. Also later in life, some hormonal imbalance can cause gynecomastia or man boobs. Our next question is, does exercise reduce man boobs? Unfortunately, like I said, it is a combination of fat and glandular tissue or breast tissue. Most men try a lot to reduce the amount of breast tissue or fat in their chest. The fat does reduce, but the gland of the breast tissue does not go away. So sadly, surgical procedure is the only way of removing the gynecomastia or the man boobs, and there is no medical therapy for the same. Our next question is, how is gynecomastia? Like I said, gynecomastia removal is a surgical procedure. It is done by a combination of liposuction to suck out the fat around that area to contour the breast, and excision techniques where we remove the gland tissue. The incision or the scars are in such a way that they're either in folds or in areas where the scars are hidden and never seen, so that no one knows that you got the surgery done after getting it done. How much time does it take to recover from male breast reduction? Recovery, like I said, is dependent on the work that you do. If you're working from home, you do it in 2 to 3 days. Physical work, as in going to office, might take about 3 to 4 days. Walking is allowed from the first day. Exercises, probably around 2 to 3 weeks, you can get back to your routine exercises. Can man boobs grow back after surgery? Usually they don't, but then if you have major hormonal imbalances, you put on a huge amount of weight, or you get back to taking steroids after the surgery, there is a very remote possibility of growing them back, but then as far as I've seen, that possibility is quite low. So these are the most searched questions on gynecomastia. It is one of the most satisfying surgeries for men. It improves their confidence to a huge level. I've seen men become completely different people after getting this surgery, especially in their confidence level. They're able to swim freely without a t-shirt. They're able to wear t-shirts and be confident. So it is an important procedure, and I hope we have helped you to understand it a little better so that you can take an informed decision on what has to be done.